Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist, and today's video we are getting into a quick and dirty trigger finger management, all the conservative strategies that I typically recommend, but we're gonna do that in 5 minutes or less. So this is perfect if you're on the go, you just want a quick summary of some options, some ideas that you can use to start managing your trigger finger or trigger thumb symptoms today. As always, while I am a certified hand therapist, I cannot diagnose you via the internet. Please seek advice and guidance from your doctor, from a medical or rehabilitation professional prior to starting any exercise program. And without further ado, let's get into it. Here are some quick and simple tips for conservative management of trigger finger or trigger thumb. Let's briefly discuss the anatomy. We have muscles in the forearm that connect to tendons that run up to our fingers to help us to bend the fingers and the thumb. Each tendon on each finger has several pulleys that it glides through that hold the tendon down to the bone. Now, in this picture, you can see there's something called the A1 pulley, which is typically the location that trigger finger or trigger thumb will occur. And essentially, there is a nodule, which is inflammation that forms around the tendon. So the tendon is actually quite thick in that area. The tendon sheath gets inflamed, and the tendon actually has a very difficult time gliding through that A1 pulley. So it's almost like trying to drive a truck through a tunnel that doesn't fit. So that's why there is going to be this catching, locking, triggering, and typically pain along with that. So what can you do about it? There are 3 top things that I typically recommend for trigger finger or trigger thumb. The first being let it rest. Second, you're going to do some gentle exercises to keep the tendon gliding and maintain your mobility. And third, you want to manage the pain and the swelling. Number 1 most important thing is to let it rest. You are going to do 4 to 6 weeks of consistent rest by using a brace. So the cause of these symptoms to occur is due to bending the finger or the thumb down. So gripping, repetitive movement of the thumb, those things are going to make this worse over time. So you want to use a brace, either an oval 8 type brace or a custom MCP block made by a hand therapist to avoid locking or catching during your daily activities. You probably want to wear this to sleep as well. Next, don't play with the clicking. Even though it's tempting and we all want to do it, the catching, the triggering, and the locking actually irritate the tendon more. So it's going to make your symptoms worse. So do not play with it for these 4 to 6 weeks of rest. Don't test it. Don't test to see if that's still happening. You're just going to make the symptoms worse. And third, you need to avoid repetitive or sustained gripping or thumb use, pinching. Try to modify your activities to use different body parts or do things a different way or use a tool to help you complete the activity. That way, you are going to let the tendon rest, start to let it heal so that you can start to have improved symptoms. Next, you're going to perform some gentle exercises because during those 4 to 6 weeks of rest, we don't want the finger or the thumb to get too stiff. So we want to maintain the joint mobility and keep the tendon gliding without causing catching. So these exercises should be able to be completed without a catch, a lock, a trigger, a click. If you are having those symptoms, please stop the exercise. You are either not doing it correctly or it's not appropriate for you. So the first exercise is a MCP joint passive range of motion stretch. This can be done for any of the fingers and for the thumb. Just make sure you stay relaxed so that you avoid clicking. Second, you're going to do a PIP, passive range of motion stretch for the fingers, or an IP, passive range of motion stretch for the thumb. And then finally, you'll finish that off with a prayer stretch. And third, you can help to manage your pain and inflammation with these techniques. So it does oftentimes help to use ice, like an ice pack or an ice massage, 2 to 3 times a day for 10 minutes for an ice pack. Elevate your hand above the heart level as much as you're able to help bring fluid out and recirculate it. And third, you can perform gentle retrograde massage, which is a very gentle massage from your fingertip down towards the palm. I hope these tips were helpful for you. Remember that healing takes time. Unfortunately, there is no overnight fix. Please try the strategies for at least 4 to 6 weeks to see if they are helping with your symptoms. And if they're not, please contact your doctor.